During the past 18 months, hospitals and healthcare systems have quickly pivoted from business as usual practices to meet unforeseen challenges brought on by the COVID-19 pandemic. Many times, this requires hospitals and systems to develop new strategies and innovative approaches to deliver care and to maintain the business to better manage crises and overcome challenges. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Netterly, Executive Speechwriter for AHA. Join us for a discussion on 8 key strategies that hospitals and systems can start implementing now, and hear how Baptist Health Floyd Hospital is applying these strategies when handling crises and managing change, including the value that pathologists can provide. Today's podcast is brought to you by the College of American Pathologists.
Thanks, Tom. I'm Elisa Arespago-Chaga. With me today is Dr. Emily Volk, Chief Medical Officer at Baptist Health Floyd Hospital in New Albany, Indiana, and the incoming board president of the College of American Pathologists. So let's get into this. The last year and a half has created a lot of opportunities for rethinking our approach to managing change, to managing through crisis, to how we lead all of this work. And I'd love to hear from you some of the lessons you've learned and the ideas you've gleaned, and particularly those you're bringing to your new role as CMO at Baptist Health. How do you approach the challenge of leading through what is, an overused word, but an unprecedented crisis?
I think fundamentally the most important thing that leaders can do is be transparent with their own humanity. I think leaders make a mistake when they think they need to be unflappable at all times, and that you have to show this strong, just almost unfeeling front to the people that are looking to you for leadership. It's not that I'm recommending that folks fall apart and break down sobbing because it's really, really hard sometimes to be a leader. That's not where I'm going with that at all. But rather, I think it can be powerful if leaders do acknowledge, this is really hard. During the pandemic, we were all terrified to acknowledge that as a leader, if you're in a tough situation with a team, that yes, this is hard. I'm scared. Just like you, I think that can actually go a long way to build trust and to, get a team on board with rowing in the same direction and working together to find solutions. So, I think acknowledging how tough things are and acknowledging that you're afraid can be very powerful.
Well, and I know you've outlined this concept of these 8 strategies that you've used, and I'd love to hear a little bit about if you give us an overview and then how you're using them at Baptist Health. The first one is very close to my heart, which I agree. I don't think you can over communicate. So, and especially to what you just said, communicating that you also may not have all the answers, I think is extremely powerful. Can you tell us a little bit about how you've defined these strategies and how you're applying them?
Sure, absolutely. So, we came up with, I came up with these 8 strategies, really working with other people who helped me identify kind of what those big 8 buckets were. But the first one has to do with over communication, over communicate. So what do we mean by that? We mean, you've got to work to get your message out in many different ways. So often, I think we think we've been heard. We think that we've, just talking about my kids, I think I've told my daughter what I mean by clean up your room, right? But her definition of what a cleaned up room looks like and my definition of what a cleaned up room looks like are vastly different, right? She's comfortable in a lot more chaos than I am. So, what good looks like to her is not what good looks like to me. That can be true across the board, right, at a hospital. So you've got, different stakeholders that have different expectations. And so being very clear about what those expectations are that I'm bringing to the table is very important, but also the stakeholders' expectations are of a project or a resolution. I've got to understand that as much as they have to understand where I'm coming from. So incredibly important, especially when you're talking about hospital executives versus laboratory staff versus physicians. And even, among physicians, there's variability. What a surgeon will think is important is not necessarily what an internal medicine doctor will think is important, is not necessarily what a pathologist will think is important. Because all of these different people are coming at these problems with a different frame. And understanding that framework is really, really important as well.
Absolutely. And I think adding to that, the number of generations and different generational approaches just make what expectations are for how you communicate so very different.
Absolutely. So, using, do you call people on the phone? If you're over 45, yeah, a phone call can be very welcome. If you're, a younger professional, you want a text message maybe. Maybe you want something on Instagram. Maybe you want something posted on Twitter to get the information. Sending out an email used to be the preferred mode of communication for a lot of us who are, I'm in my 50s. Nowadays, I get feedback that folks don't read their email because they get so many of them. So we have to find another way to break through. I think the thing that always works well is in-person communication. That, of course, was stymied by the pandemic. So we've had to learn to do these Zoom calls and so forth. So being flexible in the forms of communication we use is also an important thing to do.
Yeah, I really like that one of your strategies really focused on know what you don't know, which I think is probably a good tagline for the pandemic. But can you talk about your experience with that over the last 18 months in particular?
Absolutely. So, I'm a pathologist first and in hospital administration second. And it was really interesting during the pandemic to understand how little my colleagues in hospital administration understood about how the lab worked. It was a great opportunity for pathologists to showcase all that they had to bring to the table from a testing perspective. Making the enemy visible was exactly what pathologists were doing when they were bringing these lab tests up, right? Giving people good information. Do you have the virus or not? That information drove a lot of decisions, not only decisions around treatment of patients, but also triaging of patients. And where did we put those patients in the hospital? And what kind of isolation did we have to use for those patients? Could those patients have visitors? All kinds of downstream impact came from knowing whether or not that patient had COVID-19 or not. And then understanding that my colleagues in hospital administration didn't quite know the not only the human effort, but the materials necessary for bringing up a laboratory test like a polymerase chain reaction viral detection test, like we were doing with the COVID-19 test. Learning about the kinds of media that were necessary to have available to even collect the test, and learning about the plastic tips that were necessary to have in the laboratory to run the test, and the amount of time it required to enter laboratory test values into the computer manually if you were doing the test the old-fashioned way and not on an automated and integrated instrument. So I think just as a leader, keeping an open mind that, not only do you not have to have all the answers, you're not going to have all the answers, and being open to receiving the information is really, really important, because when we think we know it all, we're closed to receiving more information, and that keeps us in the dark. It's not a great position to try to navigate from.
Couldn't agree more. Absolutely. And one of the others that you talked about was, working related to that, working to resist confirmation bias, and that I think very traditional medical approach and training around being relentlessly curious. And how do you bring that to your leadership and to the administration part of your life?
There's a technique I certainly did not come up with called the 5 whys. And I'm sure many of the folks listening to this have used the 5 whys, or they've heard about the 5 whys, but I think that helps us drive curiosity, and therefore drive better information sharing. And it is really, in a way, a corollary to knowing what you don't know. How do you get that done? Well, you get it done by asking a lot of questions and continuing that curiosity, and not assuming that you have more information than you do. Sometimes it is, if you think you know something, or you think you have expertise that you don't necessarily have, it's easy to dismiss information that doesn't fit into the rubric you've got in your head. And, I think, quite frankly, we've seen that in the political environment that we're in. And I certainly don't want to make this about politics, but if you are on one side or the other, it's easy to just dismiss what someone who is on the other side of the fence is saying, when they may have some nuggets of truth there that would be good to learn about. So same thing if you're a hospital administrator and you think the pathologists are always in the weeds, and they're always giving me way too much information that's not relevant because they're such science nerds. So I'm going to tune them out because they're going into way too much detail. Well, it turns out, back to the testing, the challenges we had bringing up testing, those details were really important, and we had to get through to our COO what kinds of support we needed from our supply chain partners about little details like plastic tips and so forth. So again, being open to receive that information and asking a lot of questions if there are barriers to getting things done, it's really important. And not assuming that folks are really just not wanting to do a good job. I haven't met a lot of doctors or anyone working in healthcare who doesn't get up out of bed in the morning to do an excellent job. So if something's not going well, being curious about why it's not going well is also very informative, because usually it's not, Joe over there in pharmacy is just lazy. That's generally not true. So again, I think it can help in a number of levels.
Absolutely. I say that often. I don't know anyone who is in healthcare who isn't there because they want to be and they want to make a difference. So completely agree. Can you tell us a little bit about some of the other strategies that you've used as a leader, both before the pandemic and throughout?
Sure. So another one that we talk about is managing fear. And I think, again, we've talked about that a little bit in the beginning. Just acknowledging your fear can be super powerful. And again, understanding that, everyone in healthcare, almost everybody that I've ever met, is mission driven. So part of managing your fear is being okay saying I don't know, and then you get more help. So again, it's all tied to those themes of information sharing and honest communication, and just saying, I'm going to risk sounding stupid or sounding ignorant so I can get more information which will serve the people that I'm trying to help better. Other things, don't make it worse. You know, so this actually became kind of a mantra for my team as we were rounding around the hospital last year in San Antonio, because part of that was, people see the suits coming or the leaders coming down the hall in a pressed white laboratory coat. They're like, oh my gosh, they're going to start asking questions and they're going to get in the way of the front line doing the job, right? And so we need to be able to get information in a neutral kind of a way, not react immediately to it, and scare people from sharing more information with us. So if we are on the floors and we're trying to relate to the staff and trying to really get a sense of the pulse of what's going on, especially during the COVID-19 crisis, we had to establish trust. So if we went up and were very reactive to if, somebody not using their PPE correctly, or a breach in protocol occurring in front of us, if we were coming down too harshly about something like that, we would actually make the situation worse. And so we had to just stay calm, stick with protocol, and reassure the team that we were there to support them and actually help them get the tools that they needed so they could follow the infection control guidelines, so they could deal with the visitation restrictions with support from administration. And so again, they weren't terrified when they saw us coming down later. Other things that we've talked about are being aggressive early. And really what we meant about that was making sure we ramped up to the level that we needed to. So, and what I mean by that is, especially as it applied to COVID-19 testing, we had to be prepared to test not only for our hospital, but for the whole community. And so we had to be aggressive with our vendors on, getting on the list and demanding that we get the equipment that we needed. That meant invoking some of the political connections that our public hospital had with leaders at the state and in the federal government, and not being shy about letting our needs on behalf of our patients be known. And essentially that meant being good advocates for our patients. Other things that we would talk about were learning other languages. And really it wasn't that we needed to I needed to learn how to speak Spanish, which unfortunately I never did fully learn how to speak Spanish, even though I lived in San Antonio. I had to learn to speak the language of other doctors and other allied health professionals, as well as hospital administrators. Because again, if laboratorians are talking in the lingo and the jargon that we're very comfortable with someone who's not in that world, we're not doing a good job of information sharing. So again, understanding the language that people know and working in that language and translating for them our jargon and our lingo is really, really important for information sharing.
Absolutely. Couldn't agree more. I think that's one of the biggest challenges in the work we've done, working across physicians and administrators. And they're just two very different sets of views of the world. And how do we make sure we bridge that divide? So your 8 strategies sort of read as a, advice letter to your younger self almost, really giving advice to your colleagues and your team. Is there anything in there anything that you didn't include in that list that you'd sort of pass on as really the lessons learned as a leader in healthcare today?
Well, the last one of the 8 is honor your significance. And I think this one is really, really important, especially for people who are just getting started. It's easy to maybe dismiss that, oh, I'm just a pathologist, or I'm just an administrator, or I just work in the hospital, and then we forget how absolutely important it is, the work that we do every day, because it becomes ordinary to us, it becomes routine to us. And so I think stepping back and embracing the power of our unique perspective and clinical expertise, and then leverage that again to advocate for your patients. It's not being arrogant to honor your significance. Pathologists in particular, I think, have a truly unique set of skills where we literally and figuratively go between the minutia and the big picture day in and day out. I mean, we do that literally at our microscopes every day. We go from the larger picture of a tumor that's removed from a patient. We see that what we call grossly, and then we look at that same thing under the microscope at 1,000 times magnification, and look at the individual cells and the nuclei of those individual cells to get more information about that tumor that came out of a patient. And we flip between low magnification and high magnification effortlessly. This gives us special insights with the impact of small details on the larger workflow and the way the organization delivers clinical outcomes. The other thing I would absolutely encourage pathologists in particular to reject this categorization of geeks hunched over microscopes in hospital basements without enough sunlight. We all know as pathologists that each one of the slides that we look at underneath the microscope represents a human being, and represents potentially the future hopes and dreams of that human being and their families and their communities. So we get it, and we don't need to allow other people to dismiss the importance of what we do simply because they may not understand it. Not a lot of people call us up and say, thank you so much for having an accurate sodium result in my blood work last week. I really appreciate getting that glucose result or whatever. Not a lot of patients call us and say, really, thanks so much for that cancer diagnosis. I really appreciate it. Many patients, unfortunately, don't even know where the cancer diagnosis comes from. I think as pathologists, we need to do a better job of getting the word out so patients can use this as a resource, and we can be even more impactful in spreading accurate and reliable information about their healthcare.
I agree. I think there's so much value there, and such a level of pressure on the accuracy and the need for that detail. And I think that's a story that maybe doesn't get told as much as it could be. So I'm so glad that you were able to share it. Any other leadership advice you want to leave our listeners with as we wrap up?
I think the parting thought I have for the listeners is offering yourself a little bit of grace as a leader. None of us are perfect, but when we do make a mistake, acknowledge it, correct it, and move on. Again, I think folks appreciate that transparency, they appreciate that honesty, and they appreciate that acknowledgement of your own humanity, because it allows them the space to be human as well.
Absolutely. Dr. Volk, thank you so much for joining us today and sharing your thoughts and your insights, and for being a human leader that your team can relate to. I really appreciate that. I would like our listeners to know that if you'd like to learn more about the College of American Pathologists and their incoming board chair, please visit www.cap.org. Thanks so much.
Thank you.